Hello, everyone, and welcome to the second part of our financial toxicity series. Today, we're going to be talking about managing the cost of cancer care and employment concerns. My name is Amy Allen. I'm a clinical social worker in the Rochester Mayo Clinic Medical Center. Co-presenting with me today is Angie. I'll let her introduce herself.
Hi there, I'm Angela Young, patient navigator in the Mayo Clinic Cancer Center.
All right, let's get started. Today, we're going to talk about a lot of different terms, topics, and phrases, things that might be of helpfulness to you surrounding employment concerns. This is a very high-level presentation. It's going to be a lot of information. One of the reasons we've recorded this is so that you can go back and kind of re-listen to this and maybe learn something different you didn't catch the first time around. We're going to specifically focus during this presentation on Family Medical Leave Act, or also a form known as FMLA. We're going to talk about the Americans with Disabilities Act, also known as ADA, disability benefits, Social Security benefits, Consolidated Omnibus Budget Reconciliation Act, also known as COBRA, and there's a reason we like that acronym because it's a tongue twister. And we're also going to talk about open enrollment. All right, next slide. All right, we're going to start today with the Family Medical Leave Act. This is an employment rights for eligibility for individuals. So this is a federal benefit. It's available to employees and their caregivers whom are eligible through their employment for this. This act has been around for many years. Your employers should know about it. It is something that your employer needs to help you apply for. So you're going to need to talk to your supervisor, talk with your human resources, person about what is the application you need to get and have filled out. A portion of that will be you needing to complete. A portion of it will need to be your medical care team needing to complete. FMLA is a 12-week unpaid benefit. It is job protection through your employment. So this is protecting your job or a job equivalent to it within the company at the same pay. And this is for 12 weeks. It does not need to be 12 consecutive weeks. It can be a day here and a day there, depending on your cancer care, your treatments. Again, talk with your supervisors and your HR department about that. Eligibility, patients can apply through their employer. So can caregivers. Caregivers are defined by spouse, a parent for a child, or the child for the parent. So it can go in either direction. And its employer's health benefits are maintained. So what does that mean? When you're on a medical leave, your current health insurance benefits and any other benefits that you may be entitled to through that employer are maintained. Again, I want to just reiterate, it's not a paid benefit. So a lot of patients will also take their PTO or a short-term disability leave. We'll talk about that more in a future slide in conjunction with FMLA to help the financial component of their household. FMLA, the other thing I want to add about this is when you talk to your supervisor, when you talk to your HR about getting the FMLA paperwork, you how should I say this? Know that they are required to maintain the confidentiality of the situation for you. So you can share with your colleagues if you want, but you're not required to. Your supervisor is not going to be disclosing this information, nor should HR be disclosing this either. So this is a confidential process between you and your employer. Angie, anything you want to add or include?
I don't think I have anything to add other than I do really, really want to stress, because I know a lot of patients, when we meet with them, will be very apprehensive or guarded on how much do I have to tell my employer? What do I need to tell them? And I think the thing that we say is that you need to share at least some minimal information with your supervisor, really, so that you don't lose your job. Because if you just don't show up for valid reasons, but they don't know they're valid, you can be fired. But again, if we followed the proper procedure and filled out this paperwork, that validates that the reason for your leaving or your needing to be away is a valid reason, and therefore it does protect your job. So do want to acknowledge that these conversations sometimes can be uneasy and you don't know how much to say, but we do need to be sharing the bare minimum, as Amy said, with HR, with supervision, understanding that they do need to keep this information confidential. The other thing I would want to stress is that the FMLA is considered for 12 months. So that 12 weeks is for 12 months. You need to ask your employer if they follow a rolling calendar year or if they follow the standard calendar year, so January through December, because that will make a difference how your leaves will total out for the year. So do ask that question if it's a rolling calendar year or if it's a standard calendar year. And then the thing that I would like to add too is that the caregivers need to start, if a caregiver is interested in this, they really do need to start with their employer and getting the paperwork started with their employer. And then they need to work to get the medical verification form filled out by the patient's doctors. And then that information is shared back with the caregiver's employer.
Angie, those are good ads, definitely. And certainly something a lot of my patients will say to me, where do I take as the caregiver my paperwork? And you bring it to the patient's provider, not your own primary medical team. The other thing I would add that I noticed in my notes I forgot to add is that you do have to have worked for an employer for a specific amount of hours before you're eligible for FMLA. So, if you're hired August 1st of 2022 and you now need FMLA September 1st of 2022, you may not have accrued enough hours or time worked to be eligible. Even if the company has the FMLA federal law obligation to give you, you still have to work a specific amount of hours. The other thing is not all companies offer FMLA. If it's a very small company, under 50 employees, they're not required to do FMLA. I would challenge that and ask the employer, do they have other health or organizations or companies within a 75-mile radius? And if they do, they then add those number of employees as well. So if your small company in Rochester is 10 employees, but they have a company, 75 miles away that has 150 employees, that does equal enough employees for the company to be required by federal law to give you FMLA. And I have seen that need to be affected for patients. So good to keep that in mind as well. Next slide, unless you have more to add, Angie.
Nope, I think we're good.
All right, the Americans with Disabilities Act, again, also known as ADA, protects cancer patients from discrimination in the workplace. Patients in active treatment, patients who have completed treatment, you are entitled as an active patient or a patient in a survivorship or post-cancer treatment phase to ask your employer for an American Disabilities Act accommodation. And what are accommodations, kind of the buzzword that you can use at your employer? What might some of those examples be? Well, adjusting your workspace. Maybe sitting too much is hard for you, and so you need to ask for a standing desk. Or maybe adjusting your schedule. Maybe you're used to working, 9 a.m. to 6 p.m., but you notice you're a little bit more brain sharp in the morning and you want to know, can I work, 8 to noon, take a nap and come back later? Um, or change positions within the company. Maybe you're in a very physically demanding position, but there's a job in where you can do more of the paperwork and sit a little bit more. So it is always appropriate to go to your supervisor, go to your HR employer, and ask for an accommodation. I always tell patients, if they give you an accommodation, get it in writing, so that this affirms what you're going to be approved for, what the company has solidified and approved, so that down the road, somebody can't come back to you and say, you're not meeting your job expectations, and now we have a disciplinary action we want to take. And so really, really, I always encourage, get this in writing. It's also okay to ask your medical team for us to write a letter supporting that accommodation. So if we know that standing would be better for you, or working earlier in the morning would be better for you, we can write a letter. This does not mean your company is required to honor said letter. It is merely a tool for the company to better understand what would help you during this process. And then remember, getting an accommodation might help you with your financial toxicity. So if you can work part of your hours or some of your hours, or work a longer day so that you can get a treatment day off, these are some things that these accommodations can mitigate a secondary stressor in your life, and that secondary stressor being financial toxicity. So certainly, I always tell patients, if you don't ask, you don't know. It's okay to ask. Angie, would you add anything else?
Yeah, excellent point, Amy. I think just stressing, it's okay to ask. We really want this to be the point in creating awareness around the ADA is for you to know that it's here, and it's here for you to use as a resource, and to really open some dialogue between you and your employer. I think the only other thing that I would add, and that I've seen with the patients I've worked with, is your accommodations may change over the course of your treatment. So for example, a patient that's in active treatment, like Amy mentioned, maybe asked to work longer days so that you have a day off during the work week that you don't have to take unpaid, that you've put in enough hours earlier in the week so you get a day off. Where a patient that maybe is completed treatment and maybe struggles with some lingering fatigue, that's maybe where you would ask for that split, where you work 8 to noon, go home and take a nap, and then come back and work afternoon into evening. So I don't think what we want to stress is that those accommodations can change along the way, and they can look different depending on where you're at in your course of treatment, and or in what we would define as the survivorship once you've completed treatment, and you're in active surveillance. So keep that in mind, that the accommodations can change, and oftentimes do.
Absolutely. Good points. I would add one more thing. I would also say it's okay to ask us as your providers for accommodations. So something as simple as, gosh, you always work Fridays, Saturdays, Sundays at your job, and you still want to do that. So can we do your treatments on Monday so that you can have a couple of days break before you go back to work on a Friday? Or maybe you work and you want treatment on Friday so you can have a Saturday, Sunday to rest. Again, I'm not saying these accommodations can be met. I know patients that'll work and do their radiation maybe late at night so they can work during the day. Again, it's okay to ask us for an accommodation. Not necessarily can any of this be offered or extended, but if you don't ask, you don't know. All right, disability income. So we're going to start with the disability options through your employer and or through a private policy you may have purchased. So we're going to start with short-term disability, also known as STD. This is a policy through your employer, and you need to start with that conversation with your human resource team. Short-term disability does vary in length from employer. Most common duration is 3 to 6 months. While you're on short-term disability, this is often done in conjunction with FMLA. So you might actually be on 2 of your benefits at the same point. And this is going to allow you to maintain some stable income during a period of your treatment. Long-term disability is going to be a policy that you can transition into once your short-term disability concludes. This generally will go for about 12 months, can go longer, again, depending on the policy that you and your employer have. You may not be entitled to either benefit. Some companies don't have it. You may not have elected into it at the time of open enrollment or at the time that you were hired. So it is possible that you may have one benefit or the other, but you could also have both as well. The other thing that's also very common is that human resource may be the team that helps you with the short-term disability, but you may end up having to deal with a third-party policy or third-party company when you get to the long-term disability. We'll often see companies like Lincoln, Hartford, those are kind of the biggest ones across the country that patients will often talk about. So the reason I bring that up is if you start getting random phone calls from a Lincoln or Hartford or another person, they may not be spam in this case, and they may be somebody you actually do want to talk to and get involved with. The benefits is typically a percentage of your salary. And so with long-term disability, this is a point where maybe what you were making at short-term now is a lesser amount during long-term. And so this might be one of those situations where financial toxicity now becomes stressful for you or becomes apparent to you. And then also there's times where you might have a private policy. The most common one I hear about is AFLEC. It may be something that you enrolled in or signed up with through your employer, or it may be something that you signed up for privately through a different insurance representative in the community. Those policies typically are not managed by your human resource employer team. So you want to know, who do I call? What's that insurance broker's name? What's that AFLEC phone number? That's the team that's going to help you manage what are my benefits? How do I enroll? What is the application process? How much money do I make? Et cetera, et cetera. Short-term and long-term disability benefits, even though you are eligible for those benefits through your company, doesn't mean you'll automatically get them. You do have to apply for them. So this is the part where it often can be stressful for patients, because they're going to be handed this big stack of paperwork and you're kind of like, what do I do next? A portion of the form will be something you need to complete. A portion of the form will be something your medical care team will need to complete. Here at Mayo, we are very, very familiar with these forms. It is your job to bring them to us. We will make sure that we write your name and your clinic number on them, and we will get them filled out. Typically, our turnaround here at Mayo is about 2 weeks. I can't speak for other medical centers, but as soon as we get them done, we will get them back in your hands, and then you can get them moved forward to your employer, who then gets them approved. One of the things that I think often surprises patients is from the time you go to your human resources to say, hey, I want to look into this benefit, to the time you might have money through the benefit coming in, there can be this gap there. So just know it does take a little bit of time to get this process from front to end. Angie, would you add anything else?
I think just to reiterate that with those private policies like those AFLAC, also think about whether or not you have someone in the household, like a spouse or a partner or somebody that maybe has the plan that it might not be your plan, but does someone else carry a plan? Because you oftentimes can insure more than yourself. Sometimes it is the family. So do look into that and explore all options, because again, as Amy mentioned, there can be a delay in the income. And these AFLAC policies, if you have those, are oftentimes a nice filler because they will help cover some of those incidental costs, and they oftentimes are a little bit easier and quicker to process. You do need to fill out some paperwork. It is going to need some documentation from your provider. You oftentimes need to provide a pathology report, all those validating things. But yes, that is certainly something to keep in mind as another option to be doing. And again, this all will feel like a lot of paperwork at once, and we acknowledge that. So again, we're here to help you along the way. If this is feeling overwhelming, ask questions. But the sooner we get these papers filled out, the better you are in terms of having the least disruption to your monthly income.
The only thing I would add, Angie, is that short-term disability and long-term disability are not for the caregivers. So some of the slides before, like in FMLA, we were talking about, that is also available to caregivers. Short-term and disability insurance is only eligible for the actual patient. So if you take time away from your company as a caregiver, be that the spouse, the child, the parent, you do not get short-term disability or long-term disability from your employer. Even if you have signed up for that benefit, even if you've gotten that benefit maybe before for your own issues, it doesn't align in a caregiver situation.
Excellent point.
All right, moving on to disability income through the government. So Social Security Disability, SSDI. And often when patients come to me, they say, I want to sign up for disability. And one of my first responses will often be to them, are you talking employer or Social Security? And this really now is the opposite or a different type of disability for patients. And Social Security disability has some very specific requirements. The first one is eligibility based on employment hours worked and amount paid into Social Security. So you need to have worked so many hours in a lifetime and so many hours within the last decade. And so some patients can run into this issue where they don't have enough hours worked, maybe because they're younger, or maybe because they took a long extended time away from work for a variety of different reasons. So we first need to establish with Social Security, do you have enough work hours required? Then meets definition of disability as defined by the policy. And really what they're saying is that the length of your medical treatment or your medical health issues are expected to be 1 year or longer. So it's either already hindered you from working for 12 months, or we hypothesize that it will hinder you from working for 12 consecutive months. Social Security has something called the Compassionate Allowance Program. So really what this is a way for Social Security to expedite certain applications based on this list that they've already acquired and created to say these diagnoses we already know are going to hinder that applicant from being able to work or already has been hindering them from being able to work. So we're going to expedite their application review. Not everybody who applies will be approved. A lot of patients will say to me, I'm never applying. They're just going to deny me. I always say it's always good to try and apply. You've paid into this benefit. It is yours. The other thing patients will say to me is, I don't want this benefit. It's a government program. I don't want to be one of those people. Again, I always say to you, You've been paying into this benefit for years and years and years. This is you getting back the money that you've paid into the system. The other thing I would like to iterate is you don't have to be wealthy or poor or anything in between. This is not a policy dependent on income and assets. So I always tell patients, think of your favorite athlete, actor, actress, musician, whomever you can think of. Bill Gates, I always use as a good example. Again, if you meet the work requirements, you meet the medical requirements as defined by their policy, you are entitled to a benefit if they've approved you. Angie, would you add anything else?
I think the only thing I would add is that, to actually start the application process, you can do that, by an interview. You can do that by filling out the paper application. Many people will find starting the application online to be especially helpful. You can easily work on it when you want. If you do choose to do it online, just know that you do create a username and password. You will notice it is a lengthy application, and it will save your work as you go. So you can just work on it in bits and pieces. And again, this might be something where you work with a close family member, caregiver to help do some of this work as well, in addition to the patient being there to provide some of the specific patient information.
A couple of things I would add that one, it does not automatically give you money. So if you apply and get approved quickly, there is a gap in when the policy starts. It doesn't start for about 5 to 6 months, sometimes longer. Depending on certain circumstances, they may retroactively pay you. That's a longer conversation. Knowing we're trying to keep this high level, that's a future discussion. The other thing that's important to know is if you get approved for Social Security disability, it does not come with insurance immediately. Down the road, it may come with Medicare, but it will not come with insurance immediately. And so that's important to know too. And so that's one of the reasons why sometimes it's important to start applying sooner than later. The other two things I would say is if you applied 5 years ago and were denied, you applied for some other medical condition and you were denied then, it's okay to apply now. They don't take that into consideration. Or some patients will say to me, well, what if I'm denied, but I still want my benefit at 65? You're not penalized for applying now and being denied. That benefit is still yours if and when 62, 65, 67 comes. Next slide. All right, Social Security also offers a second program. It's called Supplemental Social Security Income. This is a state eligibility criteria. So it's still run through the federal government and it's still run through Social Security, but it is based on state eligibility requirements. It's based on financial needs, so different than disability. Remember, disability doesn't care about your income and assets. Supplemental income does care about your income and assets. Similarly to disability, you need to apply, and it does provide a monthly cash benefit. So this can, for some of my patients, be a wonderful bridge. Remember, disability doesn't pay out right away. Supplemental income or SSI, that turnaround time is more quickly. And so you might be able to bridge that gap by using an SSI benefit. So when you call Social Security Administration or you apply online, it's okay to ask that your application be submitted for both programs. That's not wrong to do. Anything else, Angie, that you can think of?
No, I think you covered it well. Thanks, Amy.
Yeah, no problem. All right, as we move on to our next slide, we're going to talk about COBRA, Consolidated Omnibus Budget Reconciliation Act. So if you were here in the first slide or first presentation, we did talk a little bit about this. Now we're going to take an opportunity to breathe a little bit more life into it. And so COBRA is an extension of health insurance benefits for certain qualifying events. So loss of job, reduction of work hours, Loss of dependent status. Now you've moved into long-term disability. So that can be one of the stressors when you move from short to long. Short term, you got to keep your benefits. When you moved into long, those benefits can sometimes change and you're being asked to look at a COBRA coverage. COBRA coverage covers spouse and children in event of a death or divorce or a separation. So COBRA can be used for a variety of different circumstances in your life. And it's primarily insured on the long-term disability. Again, as I said a little bit ago, when you move from short to long, this is the type of coverage you might enroll in for long-term. Electing COBRA, the employee has 60 days to elect into COBRA once you've become eligible. It's a limited length of time. That limitation per the federal government, this is a federal policy, is 18 months. That time can be extended for those whom have become eligible for Social Security disability. So if you need it extended beyond 18 months, there is an option to do so. COBRA often can be a great option for patients who weren't expecting to lose their insurance and now they don't know what to do. This can be an opportunity for you to just take a breath, look into other options while keeping your coverage. I also have a lot of patients that may just keep their coverage through the rest of the calendar year or fiscal year, depending on your policy, because you've already met that deductible, you've already met that max out of pocket, and then switch after that point into maybe an Affordable Care Act or a different state private insurance policy. Again, the goal of COBRA is to avoid a gap in coverage and then in turn avoid financial toxicity and in turn avoid any delays in your medical care. One of the other things that you can ask for, this isn't very commonly known, when you go to your employer and you start learning about COBRA, a lot of patients say, I don't want COBRA, it's too expensive, because now you're not only paying your employee premium, but you're paying the employer premium. That can really escalate the amount of premiums you're paying a month. You can actually ask your employer, what would it look like if I just covered myself and maybe took my wife or my children off of it and had them look at a private policy? Some people do that, some people don't, but it is kind of one of those behind the scenes questions you can ask about. Angie, anything else I forgot or you want to add?
I think you covered it well, Amy. The only thing I just want to stress is that with COBRA, as Amy mentioned, there is a time, a window in which you have to elect COBRA. And so we really want patients to really be thinking about this and use that 60-day window so that we make sure you don't miss that opportunity to keep that insurance. We're trying to, again, avoid a gap in coverage where you become uninsured and still needing cancer care. So again, whatever we can do to try to keep insurance going. And again, this goes back to the conversation of letting the care teams know of these situations, because if COBRA is your best choice and it's cost prohibitive, we will look into other resources. We'll explore if there's grants. We'll look at programs to see if we can help find ways to bridge the cost of that COBRA premium for a period of time until we can come up with, a plan B. So we really this is really to open the dialogue, but we do fully acknowledge that COBRA is very, very expensive. And at first glance, a lot of people think I can't do it, but we want to try to stress that it is certainly an option that we really do want to look at, and we try to look for ways to make it work.
Thanks, Angie, for adding that. All right, open enrollment. Defined time when one may enroll or make changes in their insurance plan. Private employer plans vary. I would say most companies are that October to November, early December. Some will do fiscal years though, so make sure you're understanding what your private policy and or your employer does for their open enrollment season. Medicare, there's kind of two open enrollments. When you become eligible randomly in the year, you've got an open enrollment immediately. It's called a special open enrollment. But if you're already on Medicare and you want to make changes, the national open enrollment is October through December, typically around October 7th, usually mid-December is kind of when it closes. A marketplace open enrollment is November to December in most states. Please look that up in your state to make sure you know the exact dates. And then Medicaid, some states you might know it as medical assistance. The most common term is Medicaid. That application is open all year round. Eligibility is based on state, and typical places where you can go to learn more about that is through your county human services. So if you think you might be eligible for it, call your county human services. They could certainly get you more information, or ask your care team to be referred to somebody who may know more at the medical center you're getting care. Special enrollment periods, again, we kind of talked about there might be a special enrollment for Medicare, but there's also special enrollments through your employer or private policies for a life event. So you've maybe done this years ago when you got married or had a baby, but a life event can also be a loss of a job or a loss of coverage, when you've gone from short-term to long-term. Those can be a life-changing event too, in which you have the opportunity to make changes. That change could be for yourself within your own company, or it can be to change and move on to a spouse's policy. Loss of insurance coverage, change in residence, that's another one that can be a life-changing event. And as we already discussed, marriage, death, births are other most common life events. Angie, anything else you would add as you graciously help us get our PowerPoint back to where
I apologize. No, I think you covered it well. I think the thing we just want to stress is that anytime there is a life-changing event, it's an opportunity for us to kind of relook at things. Let's look at where you're at with things. Let's look at, can we get you on a different insurance? Again, just like we want to entertain the idea of COBRA, we want to entertain the idea of what other opportunities we might have available, so that you do have that coverage.
A lot of patients will say to me, well, I can't switch insurances because now I have a pre-existing medical condition. There are some new federal laws out there about pre-existing condition. Do not let that deter you from seeking out options. I know a lot of patients that have been hesitant to look into things because, well, now I have a pre-existing condition. All right, talking to your cancer care team about financial and employment concerns. A lot of patients come and say, well, I don't want to talk to my care team. They don't want to hear about this. We want to hear about this. I'm here to tell you, we want to hear about this. So a loss of insurance or employment during cancer treatment, it's okay to tell your providers, your doctors, your nurses, your social workers. You have support from your team to explore other options. The doctors and nurses may not know what to do, but they know who on their team. The patient navigators like Angie or the social worker like myself, we have some knowledge in this area and we can help you figure out some good next step ideas. Express questions and concerns as they arise. If you left your doctor's appointment and now you thought about something, send that portal message, call into the medical team and let them know. And explore resources to help you with your needs. Again, no one can help you if we don't know what's stressful or uncertain or changing in your life. It's okay to let us know. And so, as I kind of already said, who can help? Your doctors, your nurses, the business office. I know they can be scary, but they're there. I promise they're going to try their best to help you. We also have financial counselors, the clinical social worker like myself and several of my coworkers. Angie and the patient navigator, she's got an amazing team down there. And then our patient account services, all of these resources and many more that probably aren't listed, who should be, are here to help you. Angie, anything else?
Nope, you covered that. Thanks.
And as we move into this last slide, here's just some other additional resources that we've had patients use. They're national, they're free. They will not charge you to use their wonderful expertise and resources. Some even offer wonderful classes that you can attend as well to get further information. So feel free to not only use us as your Mayo Clinic team for a resource, but these are other wonderful resources as well.